You're watching Let's Chat.
All throughout the month of February, we diagnose and hopefully get many of you treated for heart disease. It is National Heart Month, and to that end, Dr. Andrew Fowler is joining us. He is a cardiologist with the Chattanooga Heart Institute at CHI Memorial. Dr. Fowler, good morning.
Good morning, Chip. Thanks for having me on.
Yes, sir. Thank you for joining us. First off the bat, what actually qualifies as heart disease?
That's a great question, and a lot of my patients ask me that question. I think when you hear the term heart disease, what that means is plaque in the arteries around the heart. So we're talking about the coronary arteries that branch out like branches of a tree. And as we get older, we tend to develop plaque in those arteries. But that is what heart disease is.
All right. That goes into a lot of different, I guess, subspecialties, if you will, not just plaque, but disease of the heart muscle itself, heart infection. Heart inflammation is something we hear a lot about. I want to ask you about that. What causes heart inflammation, which can lead to, obviously, a lot of other health-related problems?
Right. Well, inflammation comes from the standard risk factors for heart disease. So we think of things like high blood sugar and diabetes, or high blood pressure, or high blood cholesterol, or smoking. All of these things can lead to inflammation. And when you have inflammation in the body responds. And so the way it responds is by laying down plaque, especially in the arteries around the heart.
All right, let me ask you this. A lot of folks, understandably, no other word for it, they freak out when they hear you've got heart disease. Give us some signs of heart disease and things that can entail.
Well, the goal for doctors is to diagnose heart disease early, and that way we can get aggressive with our lifestyle modification. You know, we recommend diet change and exercise. And then we also recommend medications for certain folks, depending on how much heart disease they have. But my messaging to the public would be, hey, let's try to get you checked early. Go see your primary care doctor at least once a year. Get an EKG, and if there's any suspicion based off the exam or the EKG, go see a specialist. And let's make sure that we're proactive and that we find this early.
A lot of things like chest pain, shortness of breath, pain, especially as it pertains to your left arm or the left side of your body. You shouldn't fool around with that. You should get that addressed immediately. And like with many other diseases, the sooner you address any sort of heart problems or heart disease you have, the better off your odds are for a recovery, correct?
That's correct, yeah. We call the king of cardiology is prevention, okay? So we really want to diagnose upstream before you get those symptoms. But certainly, like you mentioned, if you have any kind of chest discomfort, the words that we hear a lot are pressure or tightness, or it just feels like a stack of bricks that are sitting on my chest. Oftentimes you will have shortness of breath. You'll have radiation of the discomfort up into the jaw or down the left arm. Might get clammy, sweaty. All of these things are red flags, and if you have those symptoms, you do need to get in to see either a primary care doctor or a specialist.
All right. Dr. Fowler, thank you so much for joining us. Obviously, some good signs as we continue to roll on through Heart Month. Thanks so much for joining us, Dr. Fowler. See, you're a fan of the North Carolina Tar Heels.
Yes, I am.
Or if not, you're borrowing somebody's office who is. Dr. Andrew Fowler, thank you so much for joining us. You can get in touch with Dr. Fowler and find out the great work they're doing at CHI Memorial. The Chattanooga Heart Institute, absolutely a wonderful, wonderful place. Check them out online. Their address, ChattanoogaHeart.com, ChattanoogaHeart.com.